Welcome back to Cancer Buzz. I'm your host, Summer Johnson. Cancer Buzz is right in the middle of the action this week, on location from Denver for ACCC's 42nd National Oncology Conference, lovingly referred to as NOC. We're here with Jennifer Bires. She's the Executive Director of the Life with Cancer and Patient Experience at Inova Health System in Northern Virginia. She also sits on ACCC's Board of Trustees. Today at NOC's pre-conference, Jennifer moderated a panel on integrative oncology. Jennifer, it's really great to see you.
Hi.
Give us a rundown of who is speaking on the panel today and their specialties.
Yeah, so we had Dr. Schar, who's a radiation oncologist and a lifestyle medicine practitioner. We also had Dr. Kirsten West, who's a naturopathic physician, and Christine Meinart joined us, who oversees the website cancerchoices.org, and the three of them are really talking about how we help patients find evidence-based integrative therapies, and also how health systems can partner with people in the community to help meet this need for their patients.
You guided the room to talk about how best to support patients who have incredibly stressful lives apart from their cancer diagnoses. What were some of the highlights from that discussion?
I think one of the biggest highlights that came up was this idea of community, and how do we help patients find a community of survivors, of people who have had a similar diagnosis, who have made some of these lifestyle modifications, like improving exercise or nutrition or decreasing alcohol intake, so that they can, one, support one another and give each other guidance on how to meet some of these goals, but two, really build community, because we know isolation and the lack of social support can really be detrimental to someone with a cancer diagnosis.
The group also talked about alcohol use and recreational marijuana use. What were some of the suggestions how we approach this with patients?
Yeah, I think you saw in the room that this is a really touchy topic. One, we don't want to take things away from patients or coping skills away from patients, but we also want to support them in living a healthier lifestyle. And the recommendations aren't always clear. So we went from 0 drinks of alcohol are safe to maybe 1 to 2 drinks a month are safe, and everywhere in between there with the recommendations, with really this general idea of we need to meet patients where they're at, see what they're open to, and help them pull in healthier coping skills while maybe getting rid of some of these coping skills that may be more detrimental. And then, of course, we talked about the use of marijuana and how there are safer ways to ingest it. And while there may be ways to use it for pain control and sleep, that could be really important, but really helping guide patients and help them understand how to get it, where to get it, and what are the places that we have the most evidence for where it can be helpful.
One of the great things about NOC is the ability for pockets of different specialties to have specific educational programming. The panel you moderated today was on integrative oncology, specifically with psychosocial professionals. What other disciplines were in attendance today?
Yeah, it was awesome because there were oncologists in the room, there were administrators, but there were also nurse navigators, social workers, and I imagine other specialties that, we didn't hear from but were in this space. And I think what I love so much about ACCC is that it does a really great job pulling in multidisciplinary team members, having learning opportunities for all of those team members, but also creating these really great opportunities for collaboration. When we think about integrative oncology, that really is a multidisciplinary team. So we need the administrators to help operationalize it. We need many different practitioners, like a naturopathic physician, but we also need the buy-in from our conventional oncologists. And then all of the team members that may support it, like acupuncturists, yoga therapists, social workers, people who specialize in nutrition, and navigators to navigate them through that process. And so I think it was very cool to see so many different disciplines in the room, but also how ACCC has created these little pockets of learning for really specialized groups.
These pre-conference sessions today are a result of the partnership between ACCC and the cancer support community, which allowed this symposium on psychosocial care to take place. Why are these partnerships so important for cancer care professionals, especially in 2025?
Gosh, I think as resources get tight and we want to be more efficient in the care we're providing, that pulling together many national organizations, nonprofits, and healthcare systems really allows us to extend the reach, but also for people to be experts in different pockets, but come together to think about how those expertises play together and work together. And so partnerships with organizations like Cancer Support Community really allow a level of depth and expertise while ensuring that everyone who comes to NOC can learn something and take it away regardless of their discipline. So I love these partnerships. I hope that we're seeing more of them, and I think they'll become even more important as the landscape of healthcare changes.
Thank you, Jennifer. It's always nice to hear from you.
Yeah, glad to be here.
Follow along with Cancer Buzz this week from ACCC's 42nd National Oncology Conference. We'll be right back here again tomorrow. Until then, this is Summer Johnson.